And welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Presidential Task Force on COVID-19 briefs in Abuja, inspects international airport facilities ahead of reopening. Also frowns at low sample collections. Ogun State government announces 50% cut on land use charges to companies to mitigate the effect of the coronavirus pandemic. And U.S. Centers for Disease Control is asking states to get rid of red tape to allow distribution of a potential vaccine by the 1st of November. The Nigeria Center for Disease Control, NCDC, has reported 429 recoveries in the last 24 hours in 14 states and the FCT. Enugu State recorded the highest with 181, followed by Delta 55, Plateau State 55, Kaduna 25, Rivers 18, Ekiti 16, Abia, Ogun, Bayelsa, Ebonyi, Edo, the FCT. All 10 discharges each, 6 in Akwa Ibom, 4 in Osun, 2 in Sokoto. In the meantime, 216 new confirmed cases were registered, putting the total cases at 54,463. The virus death toll climbed to 1,027 following 4 new fatalities from Ekiti, the FCT, Ondo, and Plateau State. The 216 cases were recorded from 15 states and the FCT. Now, the top 5 states with more cases on admission include the FCT, 3,590. Next is Lagos, 2,744. Oyo is in 3rd place with 1,145. And you have Plateau, where you've seen a large number of cases on the daily updates, managing 1,119 patients. You have Edo in 5th position with 144 cases undergoing treatment. Now, the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, in his briefing today, notes that the virus is still a global challenge as numbers of cases continue to rise due to complacency and what he says is non-adherence to the COVID-19 protocols. He notes that Nigeria's case mortality rate has consistently remained at 1.9%, attributing the recent low number of cases reported to low sample collections, asking states to ramp up sample collection and testing. He was on an inspection tour of the international airport facilities ahead of the reopening. He also talked about the transition into the 3rd phase of the national response to COVID-19 for a period of 4 weeks with effect from 12 a.m. Friday, the 4th of September 2020, informing Nigerians that it is to sustain the robust multi-sectoral national response and also to ensure that we successfully navigate the community spread stage of the pandemic. To curb the spread of the coronavirus, lockdown and stay-at-home measures taken by countries across Africa had serious impacts on girls on the continent. According to Plan International and African Child Policy Forum report, the impact of COVID-19 was more severe on girls who are already faced with marginalization, exclusion and discrimination, regardless of their age, social or economic background. 2020 estimate shows that Africa counts for over 300 million girls under 18, the majority of whom are school-going children. In this next report, the National Orientation Agency engages stakeholders on solutions to gender-based violence.
Really not a pleasant one.
We'll bring you that report a little later. But according to figures from Delta State's Ministry of Health, a total of 1,595 patients have been successfully discharged from the various treatment centers in the state. While they have lost about 48 persons from COVID-19 so far, while it has carried out 8,513 samples tests. According to the government, it has achieved 99% contact tracing success rate. But let's tell you something else that's also happening in Delta State, and that is more survivors campaigning about the coronavirus pandemic, sharing their experiences, telling stories about how they contracted the virus and how they survived. For them, the era of doubt and uncertainty about the existence of the virus must be erased, hoping that it will clear doubts in the minds of people who do not believe COVID-19 exists.
The period for medication was really not a pleasant one, and most importantly, it's at a point you could probably be thinking that one is dying if the symptoms, the feelings one was getting was that you really just could not predict what is really happening. It's very unusual. Some could tell me that to be malaria, but you that is going through the feeling will also, that's going through the experience, will know that this is a different ball game entirely. So it really was not a pleasant period for me at all. Shortness of breath and tightening of the chest, severe headache. There's just this feeling of restlessness, like you just restless. You just really can't, you're thinking about the tightness or losing of breath, you suddenly just feel like you're having itchy throat and all that.
In public places, to be precise, is usually much more prevalent there because of the number of people that go into such places. And so for me, I would advise that touching of objects with bare hands and then touching your nose, your eyes and all of that is not advisable at this moment. If it's even possible to wear hand gloves, is also advisable at the moment, because you really cannot where you contract it from.
Let's take you back to that report on lockdown and stay-home measures and its impact on gender-based violence.
Sexual and gender-based violence is a global menace that spiked during the COVID-19 pandemic lockdown. According to the United Nations, Nigeria recorded 56% increase in the number of reported cases of gender-based violence during this period. And according to that report, cases of gender-based violence from 24 states rose from 346 to 794 between the month of March and the first 2 weeks of April. Discussions about what needs to be done to tackle the menace of gender-based violence is the reason for this meeting by the National Orientation Agency in Abuja.
We advocate the setting up of Sexual Harassment Act desk officers in the MDAs. 3, timely prosecution and adequate penalty for offenders.
Our government should also put in place programs for prevention, protection, and provision of services to those vulnerable groups affected, as well as ensure accelerated disposal of cases of rape and SGBV.
Other participants at this roundtable also believe that there is a need to address this problem from within the family circle.
Decreasing violence against women and girls requires a community-based, multi-pronged approach and sustained engagement with multiple stakeholders.
The fight against this menace is one that must be tackled holistically, beginning at the root cause, from inside our house.
Nigeria signed into law the Violence Against Persons Prohibition Act in 2015. However, more still needs to be done.
At the state level and at the local government level, we need the state governors to, beyond the commitment in words, to take more actions to ensure that the VAP Act, while adopted, becomes implemented and enforceable, because it's one thing to adopt, it's another thing to ensure it is enforced.
Gender-based violence is a term that describes any form of maltreatment against a person because of gender. While it affects women especially, men are not completely unaffected.
It's a clear message from COVID-19 survivors that the virus is real, yet even while over 80% in a survey by the NOI say they are aware of the coronavirus, 26% of Nigerians believe that they are actually immune to it, and for different reasons. Well, joining us right now from Abuja studio is Dr. Chijioke Kaduro. He's a public health physician, also a young doctor who survived COVID-19. Thank you for joining us on the program.
Thank you.
Briefly explain to us your experience, what you went through.
Well, I think that catching COVID was the most sick that I've ever been. The headaches were really extreme, having to deal with the difficulties in breathing and the chest tightness and the general weakness, and also getting exhausted very easily. I think it was 3 of the longest weeks for me, and being a doctor and knowing what I know and also working in the response kind of made it feel a lot more real. And the illness was as severe as it gets for me. I mean, many would say that I only had mild to moderate illness, but I think that it's really as difficult as it gets for most people.
You've come out of it and you're also leading part of the response to stop the spread. But tell us if anything has changed since the months that you've recovered and what you've come to understand about the virus as a medical doctor.
I think that for me, one of the most important things that we need to understand about the virus is that this is a virus that we're very new to. It's novel. We're learning every day about the virus and some of the effects that it has on the human body and some of the consequences of illness. So a big concern for me has been that post-recovery, it feels like there's a general fatigue with the public in terms of how they're responding to all of the behavioral guidelines that are being put out by the Nigeria Center for Disease Control and the Presidential Task Force. So I think it's so important for people to recognize that as much as, for young people, for instance, many will have mild illness and many will survive for young people. It's really important to remember that we don't know everything about this virus and that months or years after recovery, you may still continue to suffer some consequence or other from getting infected with the virus. So really the safest place is to abide by the guidelines and not get infected at all. And all of these general lack of responsiveness to the messaging and the guidelines has to stop. We really have to take responsibility and abide by all of the behaviors that are being put out there for us to keep us safe and to keep our loved ones safe as well.
The PTF is still frowning at low sample collections. Do you think Nigerians are walking away from testing because there's no fear again? And how do you think that we can perhaps reach our target testing? For example, 15,000 capacity a day, but we're doing between 3,000 to 6,000.
So, I think that it's a combination of issues. When the COVID-19 outbreak started in Nigeria and in the initial phases of the response, we didn't have the testing capacity that we would have liked to have as a country. And we've slowly ramped that up. And over over 5 to 6 months, we've gone from around 6 labs to 68 labs as at today, which means that we've really galvanized and mobilized resources to up our testing capacity. However, in the build-up to this new testing capacity, I think that we've ended up having a lot of Nigerians feel disenfranchised. People have wanted to get tested and it wasn't possible in the initial phases. People have dropped samples, and because of the inherent weaknesses in our health system and issues with logistics and supply chain, they've not gotten their results as quickly as they would have wanted to. And some of this has contributed to discouraging people from seeking testing. But now we have the lab capacity. We're in a better position to test more people. we would really like to encourage Nigerians to make use of that capacity. I mean, this is a Nigerian response that is really blazing the trail around many countries. And with our rapid increase in test capacity, we really have no excuse to not jump on it, get tested, know what's going on with us, and also seek care as much as possible. I mean, there's really no point having everyone come together to work hard to up the testing capacity if we're not going to make the best use of it for all of us as citizens.
All right, we appreciate your time. Thank you so much, Dr. Chijioke Kadura, public health physician and COVID-19 survivor. Thank you so much for joining us on the program.
All right, thank you.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. The Ogun State government, through the state's Ministry of Industry, has announced a 50% cut on land use charges to companies to mitigate the effect of the pandemic. The announcement was made on behalf of the government by the Commissioner for Trade and Investment during a tour of industries to assess the level of compliance with COVID-19 safety protocols to reduce community spread. She said this is important in order to reawaken companies on the need to be on the same page with the state government on safety and its efforts to flatten the curve of the pandemic, which has continued to affect lives and livelihoods across the world.
We're not ignorant of the difficulties encountered due to the COVID-19 pandemic, which almost crumbled economic activities around the world, Nigeria included. His Excellency and our team are reviewing several measures geared at supporting industries like yourselves operating within the states in your effort to further cushion the effects of the pandemic. An example of this is a generous discount that is given to companies who pay the Land Use charge before specified dates. If you pay before the end of this month, you get a 50% discount. This was shared recently at the quarterly meeting with the Manufacturers Association of Nigeria. There are other incentives that are being evaluated and we'll be communicating such in due course. It is also important for me to encourage you to ensure to continuously adhere to the COVID-19 guidelines in your daily operations, as our administration is working tirelessly to drastically curtail the spread of this virus in the interest of all.
We have joining us via Skype Sophia Osawe. She's a program manager and medical laboratory scientist and virologist. Thank you for joining us on the program.
Thank you for having me. Good evening.
Thank you. I want to begin with what the Presidential Task Force has said today as the country enters phase 3 of the lockdown ease. The curfew now, it says, is from 12 a.m. to 4 a.m. daily. It's lifting all limitations to land travels. We also understand there's a working arrangement. The private sector is allowed to determine the number of staff daily, but in a safe environment. In public services, only level 12 and above to go to work. We understand that markets can now be open all day. And it says amusement parks, cinemas can now operate, but bars and nightclubs are to remain closed. What do you think, this third phase from the previous phases and its impact on perhaps the virus?
Yes, I understand that, relaxing the lockdown for economic reasons, it does make sense, but I still feel the same way with other scientists and other healthcare workers that we still need to do a lot more. We need to test a lot more. We are testing, but I think the emphasis will be to test more to make sure all the samples that are collected and sent to the labs are actually getting results back and intervention are done. I'm still skeptical about just, opening places all through, because I know we have noticed that people are getting tired of being indoors. They're getting tired of the restrictions, but the reality is there. COVID is still there. We're still battling it.
With international flights resuming, do you think that there is a threat of importing a different strain from what we're battling here in Nigeria?
Definitely, that's something that is running through our minds. That's definitely a reality. But I know the aviation industry and countries and inside the airports and the airplanes, they're very strict regulations, but we all are aware that this virus can be asymptomatic. And once your borders open, other countries have faced that in Europe and in Asia. As the borders open, then we have more new cases coming in. And definitely the new strain. We know it's a virus. We know this virus mutates, which means it can change its form. So those worries are definitely there.
Right now, with regards to how we can flatten the curve as soon as possible, what would that be?
So test as much as possible, still talk to people to adhere to all the safety regulations. People are tired, we understand that, but we need to do more. And I personally believe that we should get the social scientists here and let's understand what is stopping people from wearing masks. I mean, I go out every day and sometimes I go for shopping with my kids and I see I'm the only person with my kids wearing masks. People are not just adhering, they're just not doing what they're meant to be doing. And the virus is still out there and the case is still there. So flattening the curve means we need to adhere to these safety regulations.
A lot of behavioral changes. Thank you so much, Sophia Osawe, Program Manager, Medical Laboratory Sciences and Virologist. Thank you for joining us on the program.
Thank you. Have a good evening.
You as well. The Africa Center for Disease Control and Prevention has called on African countries to unite in efforts to find and distribute a vaccine for COVID-19. This comes as its counterpart in the U.S. asked states to remove the red tape to allow the distribution of a potential vaccine by November the 1st. Here's more on our global update.
Concerns in the United States are also heightened by the fact that the number of COVID-19 cases has reached 6.11 million as at early today. The nationwide caseload amounted to 6,111,485, with the death toll reaching 185,669. Meanwhile, new data from the Labor Department shows the number of those registering as unemployed fell by more than expected last week. The U.S. economy has taken a big hit since the pandemic, with struggling businesses shedding workers to try to stay afloat. And in Spain, the unemployment minister says the country's furlough scheme will be extended for as long as is necessary. This comes as thousands of teachers undergo COVID-19 tests in Madrid, days before a fresh academic year begins in the country. Tests had to be stopped on Wednesday after the centers assigned to perform it were overwhelmed by thousands of teachers who found themselves queuing for hours and unable to comply without social distance. Meanwhile, testing centers in Paris are ramping up operations this week in an effort to reach the target 1 million tests per week in the country. The new target comes as the number of coronavirus cases in France continues to rise. As of Wednesday, there were over 7,017 new confirmed coronavirus cases. The country now has more than 293,000 cases of coronavirus. Finally, teachers have been welcoming back pupils to schools in the UK, alongside making significant changes to help keep children safe. Hand-washing tutorials, separated equipment and reconfigured seating systems are methods being applied in schools, as well as pupils being kept in smaller groups, controlling where they walk in communal areas and requiring the provision of water bottles and pencil cases to prevent sharing.
For more updates on the pandemic, take a look at our website, channelstv.com. You find the breaking story there as the federal government adjusts the nationwide curfew from 12 midnight to 4 a.m. There's several other stories on the pandemic at your fingertips, channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.